Dr Chaand Nagpaul, the Health Secretary has now announced a review into racial bias in things like the oximeters. Do you think that that will reassure people in this case?
So what I think is that we need to do a review much more widely than just devices. As I said earlier, we need to make sure that when you have drugs developed, when you have devices developed, there is a proper inclusion of all ethnic types. Even PPE during the pandemic, the tight-fitting FFP3 masks that require a tight seal were designed more for white faces. We had and also we had gender issues. They weren't fitting women and some ethnic minorities as well, which is an issue. Even in fact, I'm a GP. We manage patients and we rely on blood results. There are some blood results that are different for people with ethnic minorities, and we misinterpret them. We could misinterpret them. So what I think is this is a much wider issue, and what the Health Secretary should be doing is broadening this review to look at the way in which we, as a medical profession, have the right resources that are developed, the right information that allows us to recognize that people do have differences in terms of their ethnic or race origins, and the way we treat them, therefore, needs to be tailored for their needs. Okay. And that means effectively ethnically competent medical research and management.
Dr Nagpaul, just very quickly, they're also looking at gender as well, aren't they? So I did read that there's an issue with like MRI machines, that if you're a pregnant woman or breastfeeding, you can't use an MRI machine. So this review will also look at gender bias as well, I believe. Can you hear me, Dr Nagpaul? Have you lost me? Are you there?
Oh, sorry, I can hear you.
Yeah.
Was it Dr Pankani? Would you like me
to you, sorry, to you. Are you aware? Is this going to be part of the review,
yes,
that they're going to look at gender bias as well?
Absolutely, and there are issues around gender bias. In fact, and not just gender and ethnicity. For example, black women are 4 times more likely to die during pregnancy and following childbirth than white women. So there is a need to make sure that we look at diversity in its most diverse context, looking both at race and ethnicity, but also gender as well.
Okay.
All right. Thanks all very much indeed for your time this morning.